If you've ever wondered what happens when I stop GLP-1 medications like Wegovy or Zepbound, you are not alone. Some studies say weight comes back fast. Others suggest many people actually maintain their weight loss. So which is it? Today we're looking at two very different perspectives and why both of them might be true. Hi everyone, welcome back to the channel. So let's start with the more concerning data. A large analysis published in the BMJ, formerly the British Medical Journal, reviewed 37 studies involving more than 9,000 patients who stopped GLP-1 medications after an average about 39 weeks of treatment. Here's what they found. People regained about 0.9 pounds per month. Weight and metabolic markers like cholesterol and blood pressure often return to pre-treatment levels. And researchers estimated this could happen in less than 2 years. Even more striking, the weight came back almost 4 times faster than after stopping a traditional diet or exercise program. The authors concluded that GLP-1 drugs alone may not be enough for long-term weight control. And in an editorial response, Harvard physician Dr. Ki-Soon warned that GLP-1s are not a perfect cure for obesity, emphasizing that lifestyle habits still matter. So why are people stopping these medications in the first place? A 2025 JAMA study found that nearly 65% of people without diabetes and nearly 47% of people with type 2 diabetes stopped taking their GLP-1 medication within 1 year. The most common reasons: cost, side effects, dehydration, muscle loss concerns, and GI symptoms like nausea, constipation, diarrhea, fatigue, and hair thinning. Doctors note that older patients are often more sensitive to these side effects. Some experts believe that personalized dosing and close medical supervision could help more people stay on treatment, but that doesn't happen for everyone. Now let's talk about the flip side of this, because this is where things get interesting. A Reuters analysis of real-world data shared by researchers at a data analytics firm called Inference tells a different story. They looked at tens of thousands of real patients treated at U.S. academic medical centers, not controlled clinical trials. Among people who stopped semaglutide or tirzepatide, about 1/3 regained weight, about 1/3 maintained their weight, and about 1/3 actually continued losing weight. At 6 months after stopping, the median weight change was 0%, meaning the typical patient had stabilized. Researchers also found something important. Patients who received exercise counseling after stopping GLP-1s were nearly twice as likely to maintain their weight loss. So why do these studies seem to contradict each other? Because they are measuring different things. Clinical trials are tightly controlled, often stop lifestyle support when the medication stops, and may overestimate regain in real life. Real-world data includes people who change habits, varies in follow-up care, and reflects how patients actually live. Experts now believe the truth is somewhere in the middle of all this. Some people will need long-term or intermittent treatment. Others may successfully stop if they change how they eat, move, and manage stress while on the medication. As former FDA Commissioner Dr. David Kessler put it, it's not the drug that causes lasting weight loss. It's whether you learn to adjust your eating while you're on it. Here's the bottom line. GLP-1 medications are powerful tools, but they are not magic. Stopping them doesn't guarantee weight regain, but it raises the risk, especially without support. The future of obesity treatment likely is not everyone must stay on these forever. It's more likely personalized care, better predictions of who can stop safely, and lifestyle changes that stick because of the medication. If you're on a GLP-1 or thinking about stopping, this is a conversation to have with a provider who understands obesity medicine. If this video helped clarify things, give it a like, subscribe, and share your thoughts below, especially if you've stopped or paused a GLP-1 yourself. Thanks so much for watching today, and I'll see you in the next video.